heard about the family planning through an outreach at the Chief's Palace. Family planning has helped my family. I'm not afraid of getting pregnant. I can have a good relationship with my husband. We talk more, we play more. It has helped me.
Stories like this are no longer isolated dots on the Nigerian family planning landscape.
More women are actually coming forward to access family planning services, and this is evidenced by the number of new family planning acceptors that we see from the monthly service statistics that we routinely collect from hospitals that are supported by NURHI. Additionally, when you look at the results of the midterm evaluation conducted for NURHI in the year 2012, one could see that contraceptive prevalence rate has actually increased in all the 4 cities where NURHI operates. CPR has increased by 15.5% in the city of Kaduna, by 8.3% in the city of Ilorin, and by 3.2% in the city of Ibadan. In Abuja, by 2.3%. That is by the results of the midterm evaluation.
NURHI's innovative use of the outreach approach is a key contributor to its success in Nigeria. By taking family planning services to urban slums, outreaches have helped bridge the gap between clients and providers, as well as bridge intention to use with accessibility and availability of family planning services.
From the beginning of the outreach program, which was May 2012 to May 2014, a total of 137,314 new family planning acceptors have been reached through the outreach program, and this represents about 44.3% of the total number of new acceptors reached during the entire NURHI project.
During an outreach, the women are more happy because they don't have to wait until they come to the clinic to access family planning. They now know that they can be in their shops, in their marketplaces, and get services. So they are always very happy anytime they see an outreach in their community or in their marketplace.
Careful planning and groundwork goes into organizing an outreach.
Preparations for outreaches actually start by joint discussions or joint planning between NURHI, the state family planning coordinators, and the local government family planning coordinators. Now, the group moves to meet with critical stakeholders within the communities, and these stakeholders include traditional rulers, religious leaders, leaders of women's groups and youth groups. Now, this group of stakeholders are very important to us because they actually not only participate in the plans and the mobilization, but they also influence people to come out and take services.
We have this reference from the prophetic tradition, otherwise known as Hadith or Sunnah, that Azli, that is withdraw, whenever husband is having sex with his wife and they are afraid of he's afraid of impregnating her because of the nursing baby at hand, he could always withdraw. So that, by extension, the Muslim scholars all over, those who are experts in Islamic law, they have this what we call analogical deduction, that has given credence to the use of contraceptives. So if anybody is saying that Islam is against family planning, it is just a pointer that that person is ignorant of Islamic teaching.
The confusions we're having in the society today is because a lot of people are not giving adherence, they're not giving attention to the issue of planning their family. In the society, including the church, begins first from the family. we gather in church from families. So the nucleus of, of the church and of what God looks at is the family. Once we fail in our families, automatically we will fail in church and we'll fail in the society.
I will advise my people to buy the idea. Giving good child spacing is very nice, and protection, keeping to the rules of the family planning is very good.
After getting the buy-in of the critical stakeholders within the communities, outreach calendars are prepared, finalized, and shared with the entire NURHI team a week before the beginning of the month. We have a group of social mobilizers who are community-based artisans that use the NURHI Go card to move within the communities and mobilize potential FP users.
If we enter community, we go start to tell them about family planning and tell them, say, we dey come for outreach, show them, say, na family planning and na free of charge we dey do am.
NURHI organizes two main types of outreaches, the facility outreach and the community outreach.
It is not in all cases that we find primary healthcare centers located in some hard-to-reach slum areas. In some instances, outreaches are conducted using secure tents that NURHI has improvised, which we set up within community locations, sometimes at palaces of community leaders and community chiefs. In some cases, we camp within market areas, especially in areas where, or in markets where large number of people gather, where we set up tents within palaces of community leaders and chiefs. In most cases, it gives the people some sense of ownership.
The outreach really produced a very good atmosphere for us and educating us. And the women who came out, they went back home testifying and telling people how good the outreach was. And particularly in front of my house, they were calling other women, come and see what is happening in front of the king's house.
PHCs where outreaches are rolled out also benefit from other quality improvement strategies of NURHI. Equipment support such as basic equipment like sphygmomanometers, stethoscopes, weighing scales, medicine cupboards, where necessary sterilizers or autoclave, seats and benches for waiting areas, curtains to ensure privacy, and other items.
How soft, how gentle, how was he? How did your own assessment?
NURHI has so far trained 880 service providers in various aspects of family planning. These trained providers are the providers that man family planning clinics in NURHI-supported high-volume sites. In addition, such trained providers provide services during outreaches.
I've received training from NURHI on family planning. I've had training on all methods of family planning, including implant insertion and PPIUD.
Working with NURHI is a very good thing. NURHI really update my knowledge seriously because I don't know anything about family planning, you know. Apart from being a nurse, you have to be trained on family planning. So NURHI really trained me. After the training, the outreach really helped me in doing so many incisions.
On the day of the outreach, services commence as early as 8 a.m.
We are here in this facility doing our outreach, but it's the market outreach and Werimi market outreach. We do group counseling and we still do individual counseling. So after then, we'll ask them to do the pregnancy test for them to be sure they are not pregnant. After then, they will select a method. We don't select method for them. They select method for their self, but we do guide them in the selection. We enter inside and give them the services. This is where we do the insertion. We use this scotch for insertion of the implant and the implants, all the implants. And we use this place for injection because it's all about privacy.
As I do this family plan, my body don't fast. I do this family plan with my husband. My husband is happy.
Outreaches have given us the opportunity to touch the lives of many women who otherwise would not have been in a position to access such services freely. I strongly believe that carrying services to the people where they live, people who otherwise would not have been able to access such services, is the surest way of population coverage. Take the example of NURHI. In the year 2011, NURHI reached a total of 89,944 new family planning acceptors through outreaches conducted in only 30 service delivery points. Imagine that tempo being sustained in all cities in Nigeria, in India, Senegal, Kenya, Rwanda, Pakistan. Where will the CPR be? Think about it.